There are four things that you and your accountant or your financial advisor should be talking about before you join Medicare. Now, this probably sounds crazy because you're probably asking yourself, what does Medicare have to do with my money? But the thing is, I see too many people making the wrong Medicare decision, and then they have to decide in the future, do they want to get the best healthcare or do they want to protect their money? And so let's just be proactive and get Medicare right, go through these important topics to talk about so that you can make that right decision so you can protect both your healthcare rights as well as your retirement savings. I'm Emily with the Medicare Coach, an independent consultant helping individuals easily make their right Medicare decision to protect both their healthcare rights as well as their retirement savings. And in the section below, I'm going to share with you some extra resources to give you the shortcuts to Medicare as well. So let's hop into this. There are four things to be talking about to your CPA or your accountant when it comes to joining Medicare. And I want to preface this by Medicare has certain rules that we can't just change all of our plans every single year. There are certain pre-existing condition rules that make it really important to make the right decision because you're not guaranteed to change it every single time in the future. So, what are the four things to talk about with your accountant or your financial advisor? The number one thing is, what can you afford, right? What does your financial plan or what are your overall finances confirm what you can pay for Medicare, both in the monthly premiums, but more importantly in the total costs. Medicare has this unique thing where if you go with Medicare Advantage, it tends to have much lower premiums, and it's cheaper when you're healthy. But when you do have health costs, the costs can be extremely high and can really stress certain people's finances. On the other hand, we have Original Medicare, which tends to have higher premiums, but when you do have health issues, it's a lot less expensive, and you tend to have less denied services when you're on Original Medicare. So the first conversation is, what can you afford to pay, both in premiums and what can you afford to pay if you have a really expensive healthcare year, right? What can you do? What are we going to try to protect for so that you don't have to decide in the future, do you get the best healthcare or do you protect yourself financially? So again, ask your advisor, what can I afford to pay any month for my healthcare? Also ask yourself, what can I afford to pay or what would break me in a high cost year? If I had 5 years of $10,000, could I afford that or not necessarily? And then how do we plan for that? Okay. Number two is, how does it compare with your current healthcare costs? So if your advisor says, you can afford $500 a month in total cost, or a total of what that would be, $6,000 a year. Okay, great. How does that compare with your current health insurance? Is it more expensive or is it actually less expensive? We tend to see that many people will actually pay less once they're on Medicare when you look at both premiums as well as out-of-pocket costs. So then we ask ourselves, okay, with that extra money, what can we do with it, right? What is a good way to use that money so that if we do have other costs in the future, how can we leverage that extra money? Now, there are some people who will pay more for Medicare than they do on their current plan. And that tends to be for people who either one, have a high income, or two, happen to have a health insurance plan that's fully covered by their company and they're never sick, okay? But most people will actually pay less for their Medicare coverage than they do currently on their employer health insurance plan. So think about, how does the cost compare between Medicare as well as your current insurance, and how will that ultimately impact you? The third thing is, do you have a high income? What does that mean? As of now, as I record this, if your income is over around $100,000 filing as an individual, or over around $200,000 filing as a couple, you will pay more for Medicare. The more money that you make, the more that you'll pay for Medicare. Now, Medicare does look back 2 years at your income. So, why should you talk to your CPA or your accountant or your financial advisor about this? There are certain things that your accountant or your financial advisor could be doing right now that could result you in paying more for Medicare in the future. One thing I oftentimes see is Roth conversions, 401k distributions, certain severance packages as you leave a company. Things like that could artificially spike what you pay or could temporarily spike what you pay for Medicare. And so it's important with your trusted money people You talk about how are the decisions that you're making now impact your Medicare costs in the future. I had a woman who took out a lot of money from her 401k plan to buy a condo, and she was very angry once she joined Medicare and realized that that 401k distribution caused her to pay an extra $5,000 a year for her Medicare coverage. Again, I'm not saying that she should not have taken money out of her 401k, but I think that her and her advisor would be on much better terms now had they at least understood those implications when it comes to those income events and Medicare as well. Now, the fourth and final thing to talk about with your money people, your accountant or your financial advisor, is long-term care. Long-term care can be a very large expense, and Medicare covers basically no long-term care. And so talk about what makes the most sense for you. Does it make sense to get a long-term care policy or not necessarily? Many people are not best getting a long-term care policy, but it depends on your finances. But again, Medicare, I always say, is the missing piece to most people's financial plan. And so it's really important that you're talking about this with your money people so you can be thoughtful and kind of plug that last hole and protect all the hard work that you've done for your entire life. So I hope you found it helpful. Make sure you leave your comments or questions below, and I look forward to helping you easily make your right Medicare decision.